Hello everyone, let's welcome Dr. Monica, All India Rank 103 BDS pass out from Government Dental College, Kadapa, Andhra Pradesh. Congratulations once again, Dr. Monica, for great rank and wish you heartiest congratulations once again to you and your family.
Congratulations, beta. Such a great
Thank you,
rank.
ma'am. Thank you, sir. Thank you, ma'am.
In this exam, actually, rank 1, rank 100, they're all the same because you have seen, just by small, tiny marks, ranks are there. So you
Yes,
are
ma'am.
almost rank 1. So tell us, beta, how did you prepare? What was your journey? What was Monica's life like? And I really want to know what was your life like before.
Like I am a post-intern, ma'am. I thought to join some other institute, but I have a confusion between BDS to MDS and some other institute. But now I'm glad that I joined BDS to MDS, ma'am. I'm thankful to myself for joining BDS to MDS, ma'am.
What is the reason of being glad then?
Rank.
Not like that,
How
sir,
was the
but
journey basically? How was the journey of preparation? Your overall, you can say, coming through all the hardships of the subjects and other things.
Yes, sir. Of course, subjects are hardship, but you made them very easy, sir. I hope. You made them very easy for me. The lectures you give, the motivation ma'am gives, that was very helpful for me, sir.
How many hours per day you were studying and you were watching live classes, making notes? What
Sir,
all you did all through the year?
almost I studied for 12 to 13 hours a day from the
That's it.
starting, from the day I started BDS to MDS. And I continued till my last day before the day before my exam, and I continued studying 12 to 13 hours per day. I did not give up, and that the main reason for not giving up is for your motivation and my self motivation, sir.
So what you used to tell yourself? Why I should not give up?
Like I want the government seat anyways this year. And last year, I just missed a private college seat, so I wanted a government college seat this year anyway. So that was my motivation, and I want to make my father very proud and my parents very proud. So that was my motivation, sir. And now they are super happy and super proud of me.
Yes, even we are very proud of you. You
Yes,
are such
ma'am.
a
Thank
such a darling daughter.
you, ma'am.
So how was like what subjects were very difficult for you in the beginning? What were you
In the
like fearing
beginning,
in this preparation?
I used to fear for dental materials and perio very much, ma'am. And sometimes actually microbiology also I would fear, but uh, not many question comes from microbiology, so it was little less. But perio and dental materials, I feared for a lot, but you made it easy, sir. Dental materials, you made it very easy, sir. Thank you so much.
Thanks to you. So when you started preparing again, like last year, were you well versed with all the subjects, or when you actually started attending classes, you realized that the syllabus coverage and the text amount of theory you have to study along with this is different than what you have studied during the BDS days or maybe before?
No, sir. When in internship, when I gave exam during my and even
After
completing after completing internship, I did not complete all the subjects, sir. I completed just 10 to 12 subjects. That's it, sir. So I did not read. I know, but I completed only 10 to 12 subjects. That's it, sir. And after joining BDS to MDS by November, only two subjects were left for me, sir. And everything I completed by November, and I started revising from then, sir.
Very good. And how did you find the medical question paper? How was part A?
Medical No, ma'am, I remembered you for every question. Every question I remembered you, ma'am. The buzzwords you gave us, the one-liners you gave us, and every question I remembered you. I swear, ma'am. It was like you asked us to do the questions. Like the question will shout out you the answer, and you see the buzzwords will get the answer. Like I remembered every single line you told us in the classes, ma'am.
Okay. So medical important. Is it important to study medical or only dental can
Yes,
help
ma'am.
students?
No, ma'am, it's very important to study medicine and medical subjects also, ma'am. Like
Hmm.
so many questions are there from medicine, ma'am. Medicine,
Hmm.
physio, and everything.
So
Yes,
what
ma'am.
was your strategy in dental subjects? Because many students feel I to know dental, I have studied dental, but paper is
Uh,
very different.
but I don't feel it. The paper was difficult, ma'am. It was easy for me comparing to the mock test you gave us, sir.
Hmm.
The paper was very easy. I believe that,
That's why we gave
and
you tough.
I yes, ma'am. I felt it was very easy comparing to the mock test and GTs you gave us, sir.
Hmm.
So that
Okay, so were
I,
you giving all the tests, especially in the last 1 or 2 months? All the
yes, sir,
assignments, all the tests,
yes, sir, I gave every single test you gave in the NEET mocks, every single GT, every single
QIQs and
mixed
all
bag.
that.
Yes, sir. Yes, sir. They were very helpful, and I've seen more questions from those. That like mixed bag dental subjects, all medical, and I got many questions from it, sir. I hope
Okay. No, you did well, of course. And how many questions did you attempt, Vite?
I attempted 223 questions, ma'am.
Okay, very good. And was there any OMG moment? Like I always talk about, oh, I know this question, I left it, I did it wrong.
Actually, only two questions I think, ma'am, and they are from microbiology, so I was
Okay,
okay with those questions, ma'am.
okay.
I was not that stressed that I am leaving that question, but
Hmm.
I'm okay since it's a microbiology question. But I would have done. I thought, ma'am.
So did you attend the quizzes for micro medicine,
Yes,
patho,
ma'am.
every? And
Every
even I
single
have taken
class you
quizzes
take.
even for dental, but I'm
Yes,
surprised
ma'am.
nobody remembers that. No, everybody
No,
remembers
ma'am.
medical.
Your quizzes helped so much, ma'am. Like
Chalo,
I'm
let's
saying,
break.
I remember.
हाँ.
Yes, ma'am.
बोलो बोलो.
Like I said, I remembered for you and sir for every single question. Like sir said this question, ma'am said this question in quiz, and some question like it is there in all dental, it is there in mixed bag, and the PDFs you gave in a last minute, sir. They were also very helpful.
Okay. Chalo, let's break some myths. Okay, you tell me whether it is true or false. Like, is it important to study all 19 subjects or you can leave? Some.
No, ma'am. I think it's very important to study all the 19 subjects, ma'am.
Okay. Is it like really important to focus because I and I only give dental. So is it like to focus more on only dental? Yeah, medical may you can be like specific and you can study. Like many people study specific only.
But I don't think, ma'am, I say my juniors to study every single subject, ma'am.
Yes,
And
every single subject has to be studied.
yes, ma'am. Yes, ma'am.
Because even if questions are not coming, you gain confidence, right?
Yes, yes, ma'am.
Like till last year, surgery was actually coming, I don't know from where. It was very tough. But this year it came from your notes.
Yes, ma'am. I felt like every single question from me is from my notes, ma'am.
Yes.
I
And how?
revised notes three, four times, and every single question was from my notes. And the mistake book I wrote, and
Mm,
from many questions are from that book also, ma'am. And the
okay.
quiz notes it was very helpful, ma'am.
And is it like only pulse like this? There is a myth in India, no? Do pulse 7 times.
Pulse 10 times, 20 times in English ones.
Is it true?
I don't think questions are from Pulse, ma'am. They are more from the app, I think, ma'am. I
Mm.
did Pulse for I did Pulse for like 3 or 4 times, but I I believe that questions are more from the app. So
Okay. Now that's good, Peter. And also, please tell, were there any difficulties around the year that you faced and you had to overcome, and then you got this rank, and you want to tell other people, okay, no matter what, keep on studying.
the most difficult thing is being consistent, and I
Mhm.
was consistent throughout the year, ma'am. And I don't know, by God's grace, I was very consistent, and I did not give up. And when I was low, I used to see your motivation videos, ma'am. They
Okay.
were very helpful, and in between classes also you give motivation. That was very helpful, ma'am.
Thank you, Peter.
What is like, what are the other things Dr. Monica does like when she's not studying? Like, what makes you happy doing that?
I'll talk to my friends, sir.
Okay.
And they are my both mood. When I'm
Okay.
low, I'll talk to my friends, and they will change my mood, sir.
Oh,
That's
wow.
it. I'll watch TV. That's it, sir.
So now you are a hero in your college. Are you not?
I think so, ma'am. I think
Yes. So many
so.
people will
College mates must have been calling, messaging, congratulating on the achievement. Big, big achievement, actually.
see. One thing I am learning from Monica is that you can be calm, not anxious,
Were you always
and
like
still
this,
a winner.
right from school to college all the years?
uh, Actually, many say that I am cool and calm, but inside I'll be very anxious, and nobody knows that, sir.
Okay. Okay. Inside you are having that storm,
And
outside you're smiling.
I
What
seem to
is
be like calm and cool,
Yeah,
but I am
because
very
you
anxious.
are calm,
you
no
are coming
doubt.
like very calm. You're like you have achieved Zen. And I was about to ask you like how, because I've not achieved it yet. I am very like, enthusiastic, eager, and always anxious about stuff. And you seem so chill, Peter. That's one good
Thank
quality
you.
you have.
Thank you, mom.
Like, what is the situation when like you feel the things are not going right with you, nothing is working? How do you try to overcome that?
Like
And
I
how do you
felt
become
many
like, I'll
times
rephrase it, how you become calm again?
that like I faced like many times that this is not working. What if it will not work this year? And I thought many times like, what if it doesn't work? And I'll just sit calm and listen to the songs. I'll just motivate myself that you can do this. You can do this. Like as you told in the class, ma'am, always say you can do this, you can do this, you can do this. I used to say that that one single phrase every time when I feel low, ma'am.
And yes, and it does make a difference, Hannah.
Yes,
Even if you
ma'am.
can't do it,
Yes,
no, just keep on saying,
ma'am.
keep on repeating, I
Like
can do it.
yes, ma'am. I just keep on motivating myself. Don't be low. Don't waste the time. Don't waste the time like that.
Yes. Because half of the time is gone in being low. Then even
Yes,
when you get
ma'am.
up after the
Yes,
anxiety attack, panic attack, then you can't study. So you lose
yes,
days, right? That's very good thing. The students will be so much benefited from this particular line of yours.
ma'am.
So any message to our teachers, anyone you want to tell?
To all the
Every single
students of
staff
your
you have.
college and everybody who will be listening you, watching you, and trying to take inspiration from your success journey.
Yes, sir. Actually, I have got inspiration from Rahul Sai sir. He's a 19th ranker, and you took his interview, sir. I watched that
Remember,
interview.
I
Yes, sir.
remember
I
cricket
was
IPL
motivated by
fan,
him.
IPL fan. I remember.
Yes.
Like one day I have to give in. I manifested like one day I have to give interview like this, and this is wish come true, ma'am. Wish come true, sir.
It's on 6th of June. You are giving this interview. Note down somewhere. You have given it now.
No, it's
It's
our luck.
not you have given it. We are privileged to actually ask you questions and
Because you
interview
Sir,
you
it's
on
my
your.
pleasure that I'm talking to you, and thank you so much, sir.
every single year we wait for this time. You know why? Because not for the publicity and all. Why? Because we really want to know, how you got there.
Yes,
Because we
sir.
don't see your faces when we are teaching you.
You guys are seeing our faces in online.
No. So every year, we wait actually to know, okay, what would have been your journey? How you got what you got? And so that, you can inspire so many dentists. See, dentists right
Yes,
now, they are very sad. They are into depressive things, right? Right? So you people come out as a ray of hope. Okay, see, we
yes,
changed it, you change it too.
One last question, Dr. Monica. What
sir.
is there any change you see in the Dr. Monica in 2024-25 and in 26 after the result now?
Like I now, in the knowledge I gained in all those 5 years, was less than the knowledge I gained in this 1 year through your VDS to MDS. So thank you so much for that. And the theoretical knowledge I gained from your classes and the every single staff, every single faculty, sirs and madams you have, they are excellent and they are brilliant in teaching, sir. Not every teacher like teaches through their heart, and that your staff makes every single student understand and know the concept, and thank you so much for everything, sir.
Thank you for your kind words, Dr. Monica.
Thank you so
again.
much. Thank you. And your parents are nearby, beta. Can we wish them?
No, ma'am, they are outside, ma'am. No one is there, ma'am.
Okay, but do give them a message that
Regards,
we are proud of their daughter, and she is a lovely, lovely daughter, and she's going to make a great dentist.
Yeah, ma'am. I'll convey. Thank you so much, ma'am.
Thank
Thank
you.
you, beta.
Bye.
Thank you, ma'am. Okay, ma'am. Bye.